So the meaningful use, as that started to come out, there's 3 stages. So we're right now in stage 1, which is really about collecting structured data. Fairly simple, doesn't have a huge emphasis on health information exchange. There's a little bit, but it's really starting to get our feet wet on collecting structured data. Recognizing that if you have a text box to describe the patient encounter and it's a nice 600-word dissertation, it's hard to then go back and look at trends or diagnoses or pull out the allergies. It's really about how you break out the information so that you can get those quick snapshots. Stage 2 is going to advance us further along, and stage 3 is looking at having that bidirectional data exchange, having the decision support, and really being able to look at population health. So we know that's the destination, which hits on those goals. But right now we're at stage 1. Right now, though, part of what we really want to challenge you to do today is think towards stage 3, because it's really 2015, it's only 3 years away, and to get IT systems done, we need that time to do it. So we really need to be, even though we're in the middle of implementing stage 1, we need to be planning for stage 3. So that was part of the goal of this slide. Another thing that we've been hearing a lot as federal grantees from ONC and others is about the National Strategy for Quality Improvement in Healthcare. This was released in March of 2011 as an initial report. It's expected to continue to be revised. When we had our site visit from the ONC in June and then at the regional meetings in August, we heard this repeatedly. So we kind of expect that our next program information notice that tells us what our priorities are will have something related to this. But it's driving at that need for quality, recognizing that implementing an EHR, doing electronic stuff, it's not really necessarily cheaper. There's a huge staff involvement. There's a huge upfront cost, which of course is why the incentive program was created. But the reason for doing it is to get at this destination, again, improve quality and efficiency, and having your staff work differently to get there, to this endpoint. So I think that's part of the reason that we're seeing such an emphasis on the quality piece from the federal side. But it emphasizes very similar goals to the ones that we were highlighting before: better care, healthy people, healthy communities, and affordable care, which really drives back to everything you've been hearing so far today. So this is part of the goal of this slide is just kind of to emphasize that health is really tied to place. The idea that where we live does make a difference. And so these are 3 different maps, but the theme that you should see of the Sacramento County here is that the bright orange-red spots generally are in the same place of each of these maps. So whether we're talking about entry into prenatal care, births that are paid for by Medi-Cal, no high school degree by mom, or an infant mortality rate, we're talking about the same communities. So how do we take care of those communities? How do we find those places that really need that extra help? And when we talk about safety net, this is what we're talking about. And it's not just, again, the doctor's office. It's about the whole community, which was one of the things that was really exciting at that meeting around the child welfare and foster children, because they're really trying to tie in with the education, with education system, the court system, the different touch points. And that's where, while we're very focused on implementation of EHR and HIE in the medical setting, there are many other connections that are just waiting to be known and made, and which will really help facilitate the care of these individuals. So one of the questions that's been raised many times, especially as we start talking about high tech and all the different programs in it, is this question about, well, how does this all fit together? Give me the big picture. Can you put it all on one slide? Has anybody ever heard that? It's challenging, but I have an attempt for you here. The version without the detail is this: paper-based, electronic-based. That's kind of the ultimate destination here. Moving from that paper chart that you have to page through to try to find the information, versus having an electronic system that can support your decision-making, your assessment, and then coordinate that care and look at the population level. In order to do that, there's a tremendous amount by many different folks that needs to happen. So there's the provider-focused activities, which a lot of our high-tech grant programs are really focused around. And there's the underlying infrastructure, which at the federal and the state and local government level, a lot of our work is around that piece. Less visible to the provider, but equally important. So before diving into the detail, to give you some ideas about, well, where is it we're going? Another version, again, wanting to get you thinking so that you're ready to help engage with us as we move into the different breakouts today to give us ideas. But as a destination, thinking about what would it be? How would we do our current services, deliver our current programs, if we had fully adopted EHRs providing decision support to providers that can integrate care across multiple provider types, the right information at the right time for the right patient, like the video said at the beginning. How would we do our business differently? No matter which business you're in, private, public, state, local, how would you work differently if this were the case? What if patients and families were fully engaged in the management of their health with the assistance of mobile devices, personal health records, bidirectional communication with their providers? Again, everybody's got that cell phone. There's a lot of activity trying to see how do we send out reminders, alerts, make sure people are taking their medications, making sure they haven't fallen and they can't get up. How do we use these devices to really help coordinate care in an effective way? And then from the state side, having state systems supporting our local and state delivery of care that crosses behavior, social, medical, that really are integrated with an EHR-based environment that supports the highest quality and most efficient services to improve outcomes and the health outcomes of our constituents. Those are the kinds of targets that we're thinking about. There's a lot of detail, and we're working on it, but those are the kinds of targets. And so again, if we're in a new norm, what do we need to do differently and what do we need to build? So this is the busy slide. So what does high tech mean? I'm going to break it out so you don't have to try to read all those pieces, okay? But what does high tech mean? High Tech Act, part of the stimulus bill, really identified a number of different grant programs that were meant to work together. And so part of this role of the HIT coordinator is very specifically says, as a bullet item, coordinate all high-tech activities in your state. So one of our jobs is to try to make sure we stay in touch with all these pieces and have them connecting. And so there's a number of opportunities that we have on a routine basis to do that. Our eHealth Coordinating Committee, in particular, our monthly stakeholder calls, and many other different opportunities. But each of these programs work together to accomplish this transformation. On the bottom side, a tremendous amount of work in terms of certifying electronic health records. There's over 4,000 of them now. That makes it rather challenging for people trying to choose an EHR. They've got an awful lot of choices. This didn't necessarily narrow the range. There's standards that are still being built as we're trying to implement. Privacy and security are key pieces, again, in terms of creating that trust environment so that people feel confident that what they're doing is safe and that the patients feel confident that they're being protected and taken care of. There's lots of talk around things like health information exchange or health information organization certification or accreditation. What would it mean to have a trusted entity the same way the EHR is certified? Might there be something that certifies the HIE environment? All the issues associated with connecting, and Laura's going to talk a lot more about that piece. Integration with our government pieces, integration with all of our other providers. Pharmacies and labs in particular are called out heavily in meaningful use. They also do not receive incentive payments. So how do we use some of these resources to help them in the backbone changes, the business process changes that will help integrate and support providers? So that there's a lot to the underpinning that's happening. And our HIE Cooperative Agreement Grant that we receive at the agency is meant to help with those pieces, as well as the other kinds of coordination. So this is the interactive piece. I wanted to take a few minutes, and Laura and I really worked on this together. But we wanted to highlight the different activities. San Diego Beacon is one of 17 communities that received the Beacon grant. And as you can see, the dollar amount is fairly significant, and the time period is a little bit shorter than some of the other grants. It's a 3-year grant. They have been doing a tremendous amount of work there and will be launching December 1st their health information exchange. They've been diving into a lot of these areas ahead of some of the rest of us, and so we look to them to provide information about what's working, what's not working, and that's the idea of the Beacon communities across the country. So anybody who's working with the Beacon grant in any way, shape, or form, do we have anybody here that can stand? All right. Excellent. So we'll have more this afternoon too. Great. So those are your Beacon folks. ONC likes to tell us, get to know your Beacon grantee. So we're really excited to have them here today. A huge part of this effort, again, going back to the idea of business process change, I think one of the things that I really find admirable in the way this program was rolled out, there had been lots of studies that says if you just buy an EHR and turn it on, it will fail, it'll cost a lot of money, it doesn't go well, if you don't support the business process change that goes along with it. So the Regional Extension Centers really is a program that was put in place to try to really help move that along. And we, at this point, I think, can be very, very proud of the incredible network of our regional extension centers, our local extension centers that are working with providers. And as you can see, this is a big chunk of the grant money in California, on the order of 56 million. And they've been working and are working with many providers. And between CalHIPSO, High Tech LA, COREC, and the National Indian Regional Extension Center, we've got over 10,000 providers being touched. They're getting their EHRs installed and they're headed towards meaningful use. So everybody who works with an REC, LEC activity, would you please stand so people know how to find you? I know you're here. I know there's quite a few. Okay, so those are your REC folks. And they're really doing a tremendous job and have really had the lion's share, I think, to date in terms of interacting with the provider community directly and doing a lot of the education and outreach around this overall high-tech program. Of course, a key driver for everything is always money, and the EHR incentive programs are definitely driving the money piece. So we're very excited at this point now to have those programs up and running. And there's the Medicare and the Medicaid. So the Medicare program has been open since April, and at this point over $4 million has gone out to over 200 providers in California. Small, but still it's money flowing, and that's something to point to. At this point, CMS is posting monthly updates on their public website, so if anybody's interested in taking a look at those, they are available. But then I think the bigger part that really has folks greatly excited is our Medi-Cal program, because especially our hospitals that can apply for both Medicare and Medicaid, they needed the Medi-Cal program to come up so they could really get going on this. And the Medi-Cal program is launched as of October 3rd. Hospitals many of them worked on pre-qualifying. They are now getting their attestations in and moving that forward based on the number of hospitals that have already submitted their attestations. That would be about $160 million that should be rolling out the door very soon. So a huge amount of work has gone into that. Again, a huge team effort, and Department of Healthcare Services, Office of Health Information Technology has been the lead around that. And I know this is something that a lot of folks have been waiting for, because they need to get this incentive payment essentially reimbursing the investment they've made. So this is a very exciting piece. Groups will be rolling out in November and individual providers mid-December. So we'll be getting that up and running. So everybody who's been an instrumental role in your staff, if you could please stand.